Hello and welcome to the Ohio Council for Home Care and Hospice podcast for the month of July. Thanks for joining us and making us part of your day whenever and wherever you're watching this. My name is Drew Cook. I'm the Director of Communications here at the Council. And with me, I have three of our colleagues joining us. Lisa Von Lenden, our Executive Director. We have Jen Goldsberry, our Community Outreach Director, and Christy Piles, our expert panel focused on EVV, amongst many other things. So I want to thank you for joining us. We're going to be covering a lot of the hot topics on this webinar today. We have a big update from the governor's office. We have some exciting updates about our programs. First, I'd like to thank our member Homecare Homebase for their support of this podcast to make it happen. Quick word on them: you can learn more at their website, which you can access from either our sponsors page, or you can go to their tab at hchb.com. A lot of abbreviations in this: OCHCH, HCHB. Home Care Homebase was started in 1999 to tackle real-world challenges that nurses have on the front lines of home care. As the home care industry has changed, they have adapted with it, and they've transformed into a cutting-edge and comprehensive software platform with a variety of supportive products and services. Reach out to them. If you need contacts, we'll get them to you. So I'm going to turn this right over to Lisa and Christy, who have a big update for us on right from the governor's office this morning, right?
So thanks, Drew, and thanks for the welcome and intro. Hello, everybody. My name is Lisa Von Lenden. I'm the Executive Director of the Ohio Council. Christy and I are going to provide updates live to the minute from some of the outcomes of this year's budget. So I guess let's go through the good news first. Coming out of the House, we had both the EVV amendment that was sponsored by Representative Gene Schmidt out of Southwest Ohio, and that went into the Senate. It looked as though coming out of the Senate, they had pulled both the EVV language and the workforce augmentation language out of the Senate version of the bill. They then went into commission here towards the end of June, and we were thrilled to find out middle of last week that both our amendment and the workforce, the $2 million, which is $1 million year one and $1 million year two, to support nursing students and give them the opportunity to work with our agencies and support our agencies in mentoring them. Both of that came out of the commission, if you will, and went into the final version of the budget. I did get a text, I guess it was probably late Monday, letting me know that more than likely Governor DeWine was going to veto our EVV language. In the meantime, kind of knowing that this was a possibility, Christy and I, along with our rules committee, started working with Zach, our lobbyist, to try and get a meeting on the books with the governor's office. That meeting just happened actually this morning at 10 a.m. and I am coming out of that meeting, what I would say, pleasantly optimistic and hopeful. So let's talk a little bit about, the governor making the decision to veto it. Really, to me, and I'm actually going to ask Christy to double back on this, it looked as though he kind of made this, I would say, almost like it was done for public service, so to speak. They sort of leaned onto the feds, I would say, in regards to the why behind vetoing the language. Christy, do you want to maybe take a bit of a deeper dive and help us understand why you feel they pulled it out before we start talking about how the conversation went with Scott and Adam today?
Sure. So it sounds like from the governor's veto message, they pulled it because there's some conversation around CMS requiring states to adjudicate claims with EVV upfront. And what we've looked at the Cures Act, we've looked at CMS FAQs, we've looked at the CMS certification for EVV, and we do not see that language anywhere. But it was indicated in our meeting that there could be some updated guidelines coming out. So perhaps there's something that we don't know about yet. But that's my take on why it got pulled out. It was to do with federal funding and CMS requirements.
Okay, so let's fast forward to this morning. Zach, Christy, and myself got on a call with Scott Partika, and I believe the name was Adam Mabe from the governor's office there in Health and Human Services Policy, I believe. And we embarked upon what I would call a 20 to 25-minute explanation of EVV so that we could get an understanding of what they did or did not understand in regards to electronic visit verification and the why behind it. And when I say Christy knocked it out of the park, I mean knocked it out of the park. In fact, I was even kind of teasing her on the call because at one point she had likened one of our situations to like a parking garage with various different parking spaces in an effort to really help these guys understand, some of the upfront issues that are causing issues as we walk down the path. So Christy, do you want to talk a little bit about how you kind of positioned EVV in the current state today and what our businesses here in Ohio are facing as a result?
Sure. Yeah, we talked about how EVV functions just at a high level so they could be on the same page with us and some of the obstacles that our alternate EVV providers are experiencing. And we went through the concerns with DD needing that one-to-one matching with SAN data and not being able to do that. We talked about aging probably being in the same bucket. We went through the providers having to deal with the Medicaid ID issues for the recipients being incorrect. And it's not just as easy as discharging and readmitting someone. There's a lot that goes with that. So we told them about that. They were very curious about how provider IDs get issued. We talked about minimally burdensome because that actually is in the Cures Act, that they should be implemented, EVV should be implemented in a way that is minimally burdensome for providers. And I went through a couple of examples of how this just is not minimally burdensome and how it's actually costing providers more money just to try to accommodate what Ohio is doing. So we really got into the weeds without getting super technical, and they seem to be very receptive.
I would agree with that. I mean, I really do feel as though they actually heard what we were saying. They seemed incredibly grateful for the opportunity to have a better understanding of where the issues lie. And coming out of it, the request was that we outline kind of our top 3 action items that they need to coalesce around and take back to the governor and therefore the department. And I will say that I did get a little animated on this one. I was like, well, it just starts with you need to not pay our agencies. Like, we're out here doing business. If there are systemic issues with EVV, you can't tie the payment and therefore crush our agencies who did provide the care and had to cover the payroll because the claims aren't matching up. So Christy put together the action items. She already sent it over to us, and it's already been sent off to Scott and Adam per their request. So I would say in what to me is a matter of roughly 2.5, 3 hours, we were able to explain the situation, make an impact, talk about what we want to do as stakeholders in the community, working with the department, working with SAN data, working with our alt EVV vendors, and really get the governor's office to hear this is not about not doing EVV. It's about being able to do EVV the correct way and not disrupt business in the process while we figure out what the issues really are. So like I said, I'm pleasantly optimistic. I really feel coming off of this call today, even though I was extremely disappointed that they did pull it out of and vetoed it out of the budget. I do think coming off of today's call, we still have a shot at making an impact here for you all out there. So if anybody has any questions on that, I would say please reach out to myself and Christy. You can email both of us at our names, Lisa@OCHCH.org, Christy with a K, RISTY @OCHCH.org. But outside of that, we're incredibly grateful to the champions, both in the House and the Senate, that helped us push the workforce bill through. We will actively start working on what that's going to look like. And how it could potentially affect your agency if you're willing to step up and be a mentor to some of the nurses coming out of colleges in their juniors and senior years. So that's really all I have on the budget and the governor's office front. So I'm going to kick it back over to you, Drew. Unless, Christy, you have something more to add.
No, I do want to add a nugget because I know this has been bothering providers, rightfully so. We really were able to, thanks to you, work in the lack of payment consistency. And we tied it back to EVV not being able to see those error remittance codes to see if your EVV is working or not. So Lisa did a good job bringing that up, and we rounded it up with EVV so that they could see that not only is there a payment issue, but there's also an EVV pack because of the payment issue. So we got that in their ear for you.
That's fantastic. What a great update. And I like being able to get these updates out as they're happening. So things are very much in play right now. The fact that it wasn't in the budget doesn't mean that there won't be some action potentially in the future, right? There's other methods of making something happen. Is that right?
Oh yeah, absolutely. One of the things that we've asked for is, come to the table as a partner. Start bringing our providers, our alternate EVV vendors, and other stakeholders, payers, and ODM, OCHCH to the table, and let us help you work out these issues. It's not like we just want to dump it on them and then just go run and fix it. We have ideas to make this work better based on what we're seeing with providers. All they have to do is actually listen and help us, get there. So there's that was one of our requests is, please just come to the table as a partner.
That's excellent, because I think there are probably some people saying, "Oh, it didn't get put in the budget. That means it's dead. And there's nothing else that's going to happen because it failed here." But that's not the case. So,
I like to say every failure is another chance to succeed.
Fantastic. We learned.
I agree with that, Christy. And what I had told actually Sean Welch when I gave him report on what happened, I said, Sean, I actually think it needed to be vetoed for the governor's office to sit down with us and really hear, because to the department's credit, they have met with us every month, right? I mean, like they're giving us airtime to talk about the issues. It's just the lack of action, which could be for a myriad of reasons. But having the two folks and individuals from the governor's office hear what the issues really were today, I think does place an even bigger spotlight on the fact that we are collectively trying to help them help us. And then I think that is where we're going to see an impact. Like I said, I might be pleasantly optimistic and just have a wild hair, but I really do think that it was a great meeting, and I'm excited to see what's going to happen next. So fingers crossed.
Excellent. Let us know anything you hear on that. I'm going to turn this over to Jen. Jen, you had some also exciting updates and some fun things coming up.
Yeah, sure. Hey, everybody. Yeah, just coming off of the advocacy update that Christy and Lisa just gave. We are hosting PAC golf outings July 28th in the Avon area up in Cleveland. And then we added a secondary event September 26th in the Miamisburg, Southwest Ohio region. So we'd love to have your participation in that. There's opportunity to do a team. If it's just you, if it's doubles, triple, whatever, come in however you can to golf and or sponsor and or just attend. There's also just a networking option if you want to come later in the day, just to join, collaborate, learn more about our PAC efforts. And it's a really, really fun day out on the golf course. And then the Sunday before the Cleveland golf outing, we rented a tiki boat barge on the Cuyahoga River. So we will be sending some invites out for that, but please let me know if you're interested in participating in that as a fun outing before the fun golf outing. And then I also wanted to mention the annual conference, of course, coming up September 15th and 16th in Columbus. Hot off the presses this week is the agenda. The agenda is out, fully loaded. So be sure to check that out. Tons of CE opportunities. We really encourage you to bring your team, make it a retreat for you all, come for the 2 or 3 nights and have a really fun time in Columbus and just regroup and just reset and then learn. So, and we do have space for 72 exhibitors at that event. So you'll be able to network with them. And also if you want to exhibit and or sponsor that event, there are plenty of opportunities for that as well. So that is all from me for now.
Fantastic. Yeah, we have 33 speakers. I had to double check that. We have 33 speakers, including the 2 keynotes. The agenda is great. Obviously, for the golf, for the annual conference, go to our website. It's right there on the front page, or you go to the education tab in the events calendar. You'll see everything there. We just sent our member bulletin out earlier today, and I just want to step through a few of the important issues that were in that just to make sure nobody misses it. And check your inbox. It came from OCHCH at ochch.org. There's a few things. One is we actually got reach out from CMS directly this last few days. They were warning us of a new phishing attempt that It sounds a little lazy, but I'm sure it works. People are sending faxes. They're sending faxes pretending to be CMS. So, because you can't really verify where the fax came from, not like in a lot of digital things, it's just something that looks like it is. They don't do that. CMS does not send faxes to start an audit. So that's just fake. Ignore it. If you want to learn more about that, CMS has a whole page about fraud and scams, and that is linked in our bulletin. Also, there is a big thing that just happened on the 1st, and I want to find that both an update from OCHN and the help desk that, remember, OASIS all payer data collection began on July 1st. So that is a big change. We have some helpful PDFs and a walkthrough on their home health VBP model webpage that outlines a lot of this, but you need to be sure you're up to date on how you submit your OASIS reports. Let's see what else is happening. There is, and maybe Lisa, you're following a lot of the politics pretty closely. There was a proposal that came out talking about durable medical equipment and prosthetics. It was the Alliance just put a statement about this, and Stephen Landers was saying how negative this is going to impact the industry. That there's a proposal for the what's the actual wording here? The Home Health Prospective Payment System Rate and Durable Medical Equipment, Prosthetics, Orthotics, and Supplies Competitive Bidding Program updates. But it could cost our industry up to $1 billion because it's gonna, reimbursement is gonna go down. How set in stone are some of these proposals? I mean, when is it kind of gray? We get worried about them, we make statements about them, but how do we know when these become fact? I think that's the question I'm going to throw out to you. We're just going to monitor what the Alliance is tracking to. And you're muted.
That would be my first recommendation. And I know you were just waiting to say it. And you're muted. You do
Every
it
time.
almost
Somebody.
every time.
Somebody.
I kind of wish I could stay muted on this answer because it's going to be somewhat of a lame answer. But at the end of the day, what's really happening is there's a lot of things flying around federally right now. You got the big beautiful bill, the passage of that just occurred this week. Trying to understand the language that came out of that because it was House language and then it was changed in the Senate. But then I heard they were going to revert back to the House, but then I don't believe that they did. And then with all of these other items happening with CMS, what I do personally is I watch for the Alliance's emails and I take their updates from them. And then I sort of wait for it's happening, it's not happening. It was a concept, it died. What I would tell you is as a DME provider, you all have been through a lot of changes over the last 20 years. I mean, when did Ohio become a competitive bid state? I mean, that was quite some time ago. I've had the pleasure of talking with a group out of actually the state of Kansas that represents, I think, 8 different states, and understanding, some of the obstacles that they see as far as payment structure and reimbursement goes for DME in today's world, let alone if there are more changes made. I would think be diligent. Watch our emails. We're trying to regurgitate the information coming out of the Alliance and give it to you in terms that how it's going to affect Ohio. From a federal standpoint, I would say this: the Medicaid situation is one to watch. Those cuts, depending on how they all land, could severely affect our current Medicaid budget, and that could lead to changes in reimbursement during the middle of a budget. I mean, like we could find out that the department is going to have to go back to the drawing table here and redesign some things. And my fear, without causing alarm, is that home and community-based services is kind of the like lower on the totem pole. So we are watching that really closely. And that is why we had the call with Senator Marino last week. We actually reached out to Dr. Landers and we said, hey, these are our concerns and here's what's going on. And this is like how we think this is going to affect Ohio. And then he basically facilitated a meeting. And we did that last Thursday. Again, we're just, some of this is we have to see what's going to come. Right. But just know that we are a voice at a federal level too for the state of Ohio. I would say watch the emails coming through. Christy, do you have anything you want to add to that?
No, you summed that up perfectly. I wouldn't have said it any different.
And I don't think that's a lame answer at all. I think that's a very well thought out answer, that these policies, I mean, for anybody that watches the news a lot and gets their info from various sources, you know how fluid all of this is. So we will do our best to communicate to members what we hear, and it's all changing very quickly. And it doesn't hurt if you're really feeling it. You can reach out to your local congressman, to your representatives. Go on their websites, get their number, use their contact forms. Some of them have emails posted, and reach out. And now is better than later. So, I mean, it doesn't take a big movement. It can just take enough emails for them to at least be aware that we're paying attention, that we're listening, and that we have something to say, right? And don't be afraid to reach out. Our representatives are people too. They do want to hear from us.
And now would be an ideal time for Jen to maybe talk about the email that did just come out of the Alliance regarding the advocacy week in September.
Oh, yeah.
Typically, they usually do like one day March on the Hill, but this year they've changed it around a little bit. Jen, do you want to talk high level about that?
Yeah, I need to pull that up real quick because the date was a little confusing. I think it's oh, sorry, I wasn't ready for that. Maybe I'll
Right.
find it and put it in the chat. I can't find it.
Here's what I would say.
I
While-
think it
while
was
she's looking
September
it up.
5th. Yeah. Go ahead.
While she's looking it up, what I would say is, for those of you who've done this in the past, and we've gone down with a handful of different people over the last 5 years or so. Usually you fly in, you go to an event, that night, get your standard packet of what we're going to talk about, and then they have you scheduled the next day, rapid fire meetings with anybody and everybody from your state, and then you leave, right? This year, I will say, I think they kind of heard some of our concerns around appropriately gearing people up, making sure they're empowered to understand what we're actually doing the day that we get in front of the senators and the representatives. So this is like a 3-day affair in DC this year. And it's either the week of September the 8th or the week of
Yeah,
September
I
the
got
15th.
it.
No, it's
Yeah,
the 8th
September
because it
the 8th.
doesn't cross our, go ahead, Jim.
Right, it's the 8th through the 11th.
So my message to you all would be, if you want to get involved, let us know. I mean, even though it runs right into annual conference and trade show, we probably will have a handful of us going down there. And if there are agency representatives that want to come and join, please let us know. I mean, we'll plan to travel, somewhat together and stay in like areas so that, we can also use that time to really bond and be together. And I feel like we've got a great relationship with Patrick and the guys over at the Alliance on the GR side. So, if we really want to hit one specific representative or senator over somebody else, we can kind of give them a nudge and a wink, in advance so that we can really try and make it impactful.
Fantastic. That's a great update. A few programmatic things from our bulletin that came out. Leading Age Ohio is giving all of our members, hospice members, a discount on an upcoming training that's happening August 5th. That's about hope. Being Columbus. There's a discount code if you go to register for that. Check out our bulletin. It's there, or reach out to us for that information. We do have, we talked about golf a bit, we talked about the annual conference, but I also want to talk about our Caring Awards. These are awards that have been going on for years here at the council, for the Dorothy Rose Award, Excellence in Hospice, Excellence in Home Care, and Homemaker and Aid of the Year, and so on. These nominations are open now. If you go to our website and the annual conference page, you will see a tab that says Awards. Actually, it probably says Caring Awards, but that being the case, you can go in and nominate your coworkers or someone you know. Each of the awards has its own little caveats and certain fine print that they need to meet those conditions to be judged and so on. It's all pretty easy. There's one form. We need those nominations by the 1st, really, to be able to go through them appropriately ahead of the conference, but the 1st of August. And we'll still accept them a little after. But the Caring Awards are fantastic. Please nominate your coworkers and other caring people that you know here in Ohio. Lots of other events coming up with our partners at McMee and HPS. You can see that on our events calendar. Won't go through them all. I will mention that we do have the Fair Fair Labor Standards Act overview and hours worked coming up. This is a free webinar. The Department of Labor reached out to us to do 2 of these. The first one is coming up on August 5th, and it is free to attend for our members. It's an hour and a half. Goes over all the FLSA topics. We did these last year and they're very well attended. These are great opportunities to learn, good education. So look for that on our calendar. Scrolling. What else is worth mentioning on this?
You guys want to talk about neuro coaching?
Just on my screen now. Go for it.
Oh, sorry.
Neuro coaching. The deadline to sign up for this is July 16th, and I will let one of you 3 tell them why it's important.
Okay, so I think everybody understands my fascination and adoration of Dr. Dan Doherty. But in case you didn't understand it, had the pleasure of meeting him a couple of years ago. We've had him keynote annual conference and trade show and Spring Financial Management. And every time I walk away from one of his sessions, I walk away a better leader. I just do. I mean, I use it in real practice. I humble myself to my team. I tell them why I'm going to make the changes I'm going to make. And I put myself out there because then they can hold me accountable to it. And what I have found is it's started to soften me back up a little bit, which is kind of what I needed as a leader. It really started with the first time that I saw him speak, and you know, people have heard the story 1,000 times, but I did call my dear friend and colleague Jody and cried and apologized, because I think prior to the pandemic, I was a really fun-loving, happy-go-lucky, celebrate all the wins type of leader. And I think the pandemic really hardened me, and I started to lead through stress and anxiety. And I created this like environment where, you know, my employees wanted to make me happy, but they were also like, is she going to flip her lid today? And that's not great leadership, right? And Dan, he humbles me every time, because I come back around and I go back to basics, or I learn something new, or I learn how to have critical conversations that are going to better our council, our agencies, whatever it may be. And then I don't have to feel bad about him, because I'm delivering the message in such a way that it can be managed, it can be heard, and it can be learned from. And I think if I were to go out and hire Dan to just, you know, help like me with the council folks or with my own company, it would cost me thousands of dollars that I don't have for this type of investment. Dan actually understands that our margins are slender. And he's created what seems like an expensive, you know, program, right? I'm going to pay $1,000 to go to this. That's a lot of money. It's priceless. It is truly priceless. I'll be the first one to admit it, and I'll put my money where my mouth is. I'm sending 2 of my employees in the Cleveland area to this leadership program, because I think they're going to see massive benefit from it. If you have employees that you want to help grow, if you've got a field clinician who is a stellar nurse, and you decided I'm going to bring them in and they're going to be just as stellar, and you found that they are, but maybe they're having problem like understanding like leadership, because they're great nurses, but they've never been taught this. They've just learned it through the years. They would be the perfect candidate to go through this program. Mm-hmm. It really, really does like show you different ways of communicating, leading, and inspiring. And if I've said it once, I've said it 1,000 times. At the end of the day, he who has the employees wins the game. Invest in your employees. That's what I would say. Invest in your employees.
Great summary. And it's not just a one-off webinar. This is you have to sign up by the 16th, because it's going to build a cohort. And then this cohort of participants, along with Dan, are going to go through this 6-part series. And the first session is on July 17th. That's why we close it off on the 16th. And then July 31st. And then 1 in August, 1 in September, and 2 sessions in October to close it out. There's sort of 3 parts to it: shared vision, situational conversations, then coaching climate with emotional intelligence. All these are explained very well on our website, on the events calendar, and there's a link on the front page of OCHCH.org as well. We'll be doing an interview next week with Dan, and we'll be sharing that out as well ahead of this. So It's $900 if you have an education pass. That includes all the sessions. It's $1,000 if you don't. And then again, all 6 sessions. There's going to be homework, tasks, camaraderie, everything you want. That, I believe, is the last big programmatic update we have. So unless there's something else, we might wrap up this podcast.
I just have one other thing to add. And it's a one-off, but I wanted to share it because one of our member agencies shared with me an award. So I want to celebrate Platinum Home Health Services. Cleveland.com and the Plain Dealer named Platinum Home Health Services a winner of Northeast Ohio's Top Workplaces 2025 award. For those of you who don't know, Mark, physical therapist by education and licensure. He's been running Platinum for a number of years. I've had the pleasure to getting to know him over the last, I would say, year or so. I actually met him at annual conference and trade show last year. And I love what they're doing over there. I love what his organization's accomplished. And I want to say congratulations to you, Mark. That's a huge award. And if your agency has awards like that, send them to us. Allow us to put you on display and celebrate your awards with you. I mean, we're like a little village, guys. Like, we're doing this stuff together. So let's celebrate the wins together. God knows we celebrate the losses together. Well, we don't celebrate them. We actually mourn them. So let's do some positive stuff, right? Go, Mark. That's it. That's all I got.
Fantastic. Thanks, everybody. And we appreciate you making us part of your day. Look forward to future updates. Remember, check your inbox for the bulletin that came out today. We thank you for your support. Let's keep those wins coming. And thank you to Jen, Christy, Lisa for joining me. Everybody have a wonderful afternoon and enjoy the July 4th holiday ahead of us if you're listening to us now, or I hope you had a good one if you're catching up next week. Thanks, everybody.
Happy 4th.
Thank you.
Bye, everybody.